Bellevue regular city council meeting for January 11th, 2021. We lost a pillar in our community last week, and with the loss of former city staff member, Captain Paul Bader. I'd like to ask Councilmember Lee to speak to that, if you would, please.
Thank you, Madam Mayor. I'd like to say that we lost a friend, a longtime council employee, Captain Paul Bader. He passed away on January 3rd, 2021. His wife of 52 years, Joanne Reuben Bader, was at his side. Paul worked for the city council for 9 years. He was the executive assistant for the city council, and he was a very consistent, very faithful person that served the council very well. And he also was retired as the US Navy captain. And so when people ask him what was he doing in the Navy, his answer is always protecting the country. So we are very sad of his passing away because of Parkinson's disease. And so we wish him and his family the best. We have them in our prayer, in our thoughts. So for Captain Bader, fair wind and following sea behind you. Captain Bader. Thank you.
Thank you, Councilmember Lee. All right, moving on to roll call.
Mayor Robinson.
I'm here.
Deputy Mayor Neuenhouse.
Here.
Councilmember Barksdale.
Here.
Councilmember Lee.
Here.
Councilmember Robertson.
I'm here.
Councilmember Stokes.
Here.
And Councilmember Zahn.
Here.
Thank you.
Okay, we have an approval of the agenda, but I'd like to amend the agenda to include an opportunity for the council to reflect on the diversity summit, the Diversity Advantage Initiative summit that we had on Friday. So Deputy Mayor, could you make that amendment, please?
I certainly can, Mayor. Did you want to do the flag salute prior to that, though? Or did you want to do the roll call first? Or sorry, the approval of the agenda first?
Well, I blew right through the flag salute, so let's go back.
Okay.
And could you please lead us in the flag salute?
It would be my pleasure. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
All right. Thank you very much. Now, could you amend the agenda?
Certainly. I move to approve the agenda amended to add one item under council business and new initiatives to discuss the Diversity, Equity, and Inclusion Summit, which occurred this past Friday.
Second.
All those in favor, say
Aye.
Aye.
Any opposed? Okay. So we'll move on to oral communications. City Clerk, do we have anybody for oral communications tonight?
Thank you, Mayor. This evening, there are 2 speakers pre-registered. And with that, I will call our first speaker, who is Christian Dorset. Mr. Dorset, can you hear me?
Yes, I can.
Great. Your time begins now.
Oh, okay. I would just wanted to say that this sounds like a good idea with the way the city's handling it on this issue. That's all I had to say. Thanks.
Okay, thank you very much. Are there any other people lined up for oral communications?
Yes, the second speaker this evening is Ray Cullum.
Okay.
And Mr. Cullum, can you hear me?
Yes, I can. Hello.
Great, thank you. Your time begins now.
Great. Thank you, Mayor Robinson, the City Council. I'd like to take this opportunity at the start of this new year to introduce a new cultural and community development non-for-profit organization called East Hub. My name is Ray Cullum and I'm the organization's CEO. East Hub's goal is to make Bellevue and the East Side the cultural capital of the Northwest, and to reinvent the way cultural and community gathering spaces are developed and invested in by the community as a whole. East Hub brings together East Side businesses, cultural and community groups, real estate developers, government, and philanthropists to build cultural spaces in a manner that is faster, cheaper, and more efficient than the traditional standalone model for cultural space construction. With the rapid pace of development, we have a very short window of opportunity to ensure that we develop and embed cultural gathering spaces in our communities, utilizing both donated spaces within new development projects and the inclusion and revitalization of existing cultural spaces to create a comprehensive network of cultural spaces. The end result is an activated and vital 18-hour downtown core and community-level cultural spaces embedded in neighborhoods where they can all get the best use. This network of cultural spaces will include music and dance rehearsal studios, theaters and immersive galleries and installation spaces, live music venues, and flexible community use spaces of many sizes and shapes. Our goal is at least 16 new cultural gathering spaces within our first 5 years. And our first major project will be a 1,000 capacity playhouse and music hall just up the block from City Hall, part of the Cloudview project on 110th Street, which comes thanks to an incredibly generous donation of land and infrastructure, including parking garages from the developer Lawrence Louis. Most importantly, rather than dictating to the community the types of spaces they will be getting through an intensive process of community engagement known as consensus organizing, we will be asking our community about the types of spaces they want, need, and will utilize. East Hub presented to the Arts Commission last month, and I'd like to take this opportunity to thank them for all their very productive feedback. Our staff, our board, our committed group of supporters, including some very strong and key support from our good friends at Microsoft, all thank you for this opportunity, and we look forward to entering conversations concerning the potential for a robust and productive working relationship with the City of Bellevue. Thank you.
Thank you, Mr. Cullum. I would ask at this point if there are any attendees in this meeting who would like to provide oral communication to the council. I do see one hand raised. So Ms. Ruth Lipscomb, can you hear me?
Yes, I can.
Thank you. Your time begins now.
Thank you. My name is Ruth Lipscomb, and I'm a Bellevue resident living in the Newport Shores neighborhood. Hello, Mayor, Deputy Mayor, and council members. Madam Mayor, I appreciated your statement condemning the horrific assaults on democracy that we witnessed this week, but I took issue with one sentence where you stated that it is now time to move on and begin the process of healing. No, there is no unity without accountability, full stop. My request to you tonight is for a complete investigation and a full reporting to the public of whether any City of Bellevue employees, either police or other staff, were present in Washington, D.C. or Olympia this week. I want to know if any of them participated in the breach of the Capitol building or in the trespass at the governor's residence. There's a huge difference between peaceful protests and insurrectionists forcing access to a protected area to intimidate and threaten those doing the work of our government inside the building. I hope that anyone involved in the illegal actions in either Washington, D.C. or Olympia this week will be immediately terminated. Thank you very much.
Thank you. And is there anyone else connected to this call who would like to provide oral communication to the council? Please use the raised hand function or *9 if you're connected with a phone. And Mayor, I do not see any additional hands.
Okay, thank you. City Manager, would you be able to report back to us? Because I think we'll all be interested in the answer to that question.
Sure, Mayor. Good report back.
Thank you. Okay, we are moving on to the report of our City Manager, Mr. Miyake.
So we have 4 items under the manager's report tonight. And the first one is an update on the COVID-19 pandemic. I am pleased to introduce Patty Hayes, the Director of Public Health for Seattle and King County, who is here tonight to provide us an update on the COVID-19 pandemic, its impacts on King County, as well as the county's response. Ms. Hayes serves as the Executive Secretary and Administrative Officer of the King County Board of Health, has been a leader in the pandemic response efforts across King County. Tonight's presentation is informational, and following the presentation, Council will have an opportunity to ask questions of Ms. Hayes. With that, I'll turn the floor over to you, Ms. Hayes.
Thank you so much. It's a pleasure to be here with you all tonight and to give an update and answer questions and talk a little bit also about the opportunity that brings us with vaccines. So first, I want to stop and thank all of you for your leadership over this past year. What a year it's been. It's almost 1 year to when the first case up in Everett was identified. And soon in February will be 12 months from when we had the outbreak at Life Care. And it has truly been an all community effort, and the leadership shown at the local level and from our elected officials has been so important in terms of the protecting of our community and really honoring all those who have succumbed to this horrible pandemic and the lives that have been affected, which will be generational. We know that the trauma that in the hurt of our economy will take a long time to recover. So I just want to give you my gratitude for how you have supported the community and partnered together. As I look across the nation and what colleagues of mine have been dealing with, I am so grateful to be here in King County with the leadership we've had and the really unity in response, even with hard times and hard questions and the challenges we've all had. So thank you so much. To start with, I do want to give you the latest numbers, and so I will share this 7-day moving average number. I get these actually every day. I wanted to share this one from today with you. This is a 7-day moving average of new cases that are reported to us, and we adjust them for the date of test result. We do that because as public health, we need to track when the test result was because we're looking for the rate of the infection and when people are in that infectious period. So as you can see, after the November Thanksgiving time, there was an uptick, and then we had this wonderful drop in cases that went actually till towards the end of December. We have been concerned about an uptick in cases that we might experience after the holidays in December. And indeed, it does look like we are seeing a little bit of an uptick, although over the past few days, it might appear like it's leveling off. We're just not really sure because we get these reports in and you have to consider the last few days tentative. So I'm hoping we will not see the spike go up to the level prior to that number in December 5th. This really is challenging when the outbreak gets this wide. We see the number one common thing when we talk to people who have coronavirus is that it appears that it was spread within the community, within family gatherings, within small gatherings that were either in a neighborhood, possibly at church, possibly at where other types of gatherings are occurring. So what happens then, of course, is that folks come away from those gatherings, they come down with symptoms, and then they transmit it to family members. And then, unfortunately, we also see it come into outbreaks in the workplace. So we are seeing quite a few outbreaks right now that our team is dealing with in both businesses and in the healthcare system and in nursing homes. So we are really encouraging everybody to hang in there with us and continue with the strategies that we know tamp down this virus. We've done it before, we can do it again. It really is wearing your masks. It is physically distancing yourself from folks. It is avoiding those gatherings as much as possible. It is making sure that when you're out and about, you're really being cautious around folks that you don't normally have in your home. And then, of course, keeping surfaces clean and really taking care of each other. So this is going to continue to be, Dr. Duchin is very concerned about the next 2 months. The winter period, just because people are indoors and the ventilation isn't that great, is really a challenge. So we are expecting this to continue right here. But hopefully this will flatten out. We are very blessed in that our hospital system has not been overrun, so we are not experiencing what you've seen in other parts of the country. The hospitals are stressed out. We watch a report from them on a daily basis. They are in conversations with each other. None of them have had to go into crisis standards of care where they have to either limit some type of service or they have to transition patients elsewhere. This is what you're seeing happening in California, where people have long waits outside and are unable to get the care that they need. So the precautions that we take and getting these numbers down help ultimately protecting our healthcare system. You may have heard that in some of the places in Florida and in Arizona and in California, folks that are having other problems like heart attacks, who need access to that healthcare system, need care, are having trouble getting in because the hospital's overrun with COVID or the EMS system is overrun. So I'm grateful that we have managed so well. I knock on wood every time I'm doing one of these presentations because we want to make sure that we keep the course and are able to keep our healthcare system functioning for us. I do want to spend a few minutes. I'm happy to answer any questions on that, but I do want to pivot to a couple of other things. One is that you've heard about the variant that has surfaced in Europe. There's also, this is not uncommon with these novel viruses, brand new viruses. They do alter themselves, but I want the council and others listening in to know two things. Number one, we haven't picked up a lot of the variant here in King County. Even on the West Coast, the testing that has been done hasn't shown that it's prevalent here yet. Dr. Duchin feels that we are at risk for that in the next month or so, but right now, the testing that's happening through the CDC and the University of Washington isn't finding it prevalent. Secondly, the science is taking a very close look at the folks who have that variant, and it is expected that the vaccine will be effective against the variant. It's not known if the protection level is going to be as great. These vaccines that we have available are actually 95% effective, which is just amazing for a brand new vaccine. That is just tremendous. So we're watching this very closely, but Dr. Duchin has confidence that the vaccine will be effective, and they will continue to study the new variants and the implications for that. But what I wanted to talk to you also about is we are really looking at our plan for vaccination. As you know, the hospitals in the area have been receiving vaccines since mid-December, and they have all been ramping up their own vaccination for the 1A population. And the 1A folks are those that are the healthcare workers, particularly frontline healthcare workers first, those that are in the COVID units, those that are in the emergency rooms, those that are working closely with patients every day, are emergency medical personnel, and then our nursing homes. So those three groups are quite a large group here. There's about estimated of at least 100,000 healthcare workers here. There are around 5,000 total EMS personnel, and there's around 40,000 that are working in long-term care and the long-term care patients. So that is a big chunk to get to. And I just looked at the statistics today, and we are just shy of vaccinating 70,000 people in the county so far, just in that short period of time. Now, there has been some, and you've seen articles about the slow uptick of the vaccine getting them into people's arms. And that's due to a number of different things. Number one, the way the state's been allocating the doses, it's not totally transparent to public health. We're negotiating with the state right now so that we can actually help move it around. I've talked to a couple of hospitals who were telling me, we're ready for more doses. We could do more to get us through 1A if we had more doses. So we want to make sure we've got doses going to places that are ready. And then the second thing for your long-term care facilities, although I'm sure many of you saw Life Care in the press when they started getting vaccinations there at Life Care in Kirkland. We know that the pharmacy partnership that has been done between the long-term care facilities and the pharmacy chains has been slow to get started. We're working hard with the state to put pressure on to make that go faster, because the faster we protect those individuals in long-term care facilities, we know they are the most vulnerable against this virus and they have the highest mortality. So the governor has released the guidance for what's called phase 1B, which has a number of subcategories in it that I think you'll continue to see some refinement. But the first subcategory is going to be individuals over the age of 70, and then individuals over the age of 50 who live in a congregate setting, a household setting or a congregate setting with older individuals. So we're looking at those numbers and how to make vaccine available, as well as the 1B2 group, which are more of the essential workers, the frontline essential workers, which can be everything from our fire and police to teachers and folks working frontline in grocery stores, et cetera. Very important folks who have done such an amazing job during keeping services going during this pandemic. And so King County is launching a 6-point multimodal strategy to this that you heard Executive Constantine announce last Friday. The purpose of this is we know to get out as these populations come up in line to get the vaccine, that it's going to take a lot of different types of strategies to make it successful to get to folks. So we're using our mass testing model that we've developed and looking at that to do some mass testing sites where people can sign up, come in, and in a central area, get mass vaccinations. We are looking at mobile strategies. What's the purpose of mobile? Well, we know there are homebound elderly. We know that there are folks that in adult family homes who really should not come out of their home to try and travel somewhere else to get the vaccine, that the best thing to do is to take it to those folks. That's very labor intensive, but I think it's a very important strategy to employ. Then the idea of pop-up centers, where maybe at a senior center, maybe at a large facility of one of our business partners, would set up a vaccine for maybe a special type of population, maybe a special essential worker, or just so we can get a group in a certain area done. Then we're counting on our hospitals actually to continue the work that they're doing and actually expand it. We want them to open it up and begin to vaccinate more broadly. One of the things that has been challenging for some of these hospitals is we not only need them to vaccinate their own folks, we need them to vaccinate some of the medical practices that are due for the vaccine, but they're not affiliated with the hospital. How do we get those people connected is really important. And then, of course, pharmacies. Pharmacies are going to be very important partners. We need them to really step up in a large way, both by using their staff to help us in some of these other venues, but also how we partner. For example, if you went to Safeway, could you sign up to get a vaccine while you were there if it was your time in line? So we're working on all of these strategies, and it's all dependent upon really how much vaccine we're getting every week. One of the challenges is that the state is only informed by Operation Warp Speed 1 week at a time as to what the vaccine allocation is going to be here in King County. I mean, what the vaccine allocation is going to be in the state and thus in King County. That puts my team at a real challenge. It's hard to plan, as you can well imagine. How do you plan 4 weeks out? So what we're going to do in looking at some of the projections for what the state thinks they're going to get is to start with 2 large mass vaccination sites. We're going to start where we know that the positivity rate and the outbreak is at the highest, and that is in South King County. But our vision is that this would expand where we would have many more of these mass vaccination sites around the county. And I'm hoping to have many partners with businesses and others in our healthcare system to put that together. And then also we want to do some mobile strategies from the very beginning. We know we need to get to the adult family homes across the county, and we will be partnering with our EMS providers to help us with that, as well as we've had a partnership with Harborview and some others that have been emerging to help us with that. So we're really looking at how we start, and as we get the knowledge of more vaccines out there, we will accelerate this and make it possible. We also know that there are certain people that are hesitant to get this vaccine. This vaccine has been gone through the clinical trials and safety standards. Dr. Duchin is very confident in the vaccine, and in the as I volunteered at one of our vaccination clinics, folks were tolerating it great. They were excited to come and get their vaccine. We had a lot of the EMS personnel coming in, really happy to get their vaccination to continue to serve their community. So with that, I know that's a lot of information to throw your way, but I'm very happy to answer questions.
Okay, thank you very much for the presentation. I can see everybody, so if you have a question or a comment, please raise your hand. Okay, I see Councilmember Zahn and Councilmember Barksdale. I think I saw Deputy Mayor Neuenhuis. I see Councilmember Robertson. Go ahead, Councilmember Zahn.
Yes, thank you. Well, first of all, thank you, Director Hayes, for all your leadership and work throughout this entire, just unprecedented pandemic, where there really isn't a rule book for this. And so we are finally here at the place where again, just amazing to have a vaccine in really just a year. So a couple of questions that I had, I think it's really important, as you said, to look at how we efficiently make sure the vaccine gets into the arms of our most vulnerable. I've had some questions about when we talk about essential workers, it shows, I believe, food processing, and I've had some questions about whether that includes restaurant workers, cooks, and folks that are working in kitchens. So I'm wondering if you can help a little bit with, beyond the obvious, right, first responders and teachers. Can you comment a little bit more about what essential workers designation means?
And Patty, can you also go over how people can find out what category they are in? I know there's a really good app available.
Right. Thank you for that reminder. So I just was meeting with the brand new Secretary of Health, Dr. Umair Shah, today. And one of the things we were talking about, and he was actually had to leave early to go talk to the governor, is that the phases that they have put out, they're recognizing that there needs to be refinement and guidance along this in terms of answering some of the questions on, if you're looking at folks who are working in grocery stores, who are you talking about would be in the front of the line? Or are we going to have enough vaccine to sort of not worry about that and let more people come? So I think you're going to see more guidance along that way. It's been so challenging, I know, for them to try and guess how much vaccine they're going to be getting. And then they tried to go to a level of refinement. One of the things that we're very concerned about is if we do a mobile strategy and we're going out to a housing situation or an adult family home or a shelter, it's going to be very difficult to do this in steps, in these phases. If you're going out, do you really just take care of everybody at the same time? So that's to just say, stay tuned. We're going to get this. We're going to get through more of 1A, get more refinement on, as you said, essential worker definition over the next few weeks. And then if indeed President-elect Biden opens up for more vaccine to flow more quickly, I think you'll see that they'll open these phases up a little bit somehow. I know we're going to start with the 70-year-olds and older as the most vulnerable, but that next 1B2 with the essential workers, I think you'll see refinement there. For you to find out your place in line, the Department of Health has launched Phase Finder, which allows you to put your data in there to see where in this set of phases that you are in line. And we are hoping that they're actually going to connect to that. So eventually it will allow you at that same time, if you are at the front of the line and you could find out not only where in your area you can access a vaccine, but make it easy for you to make an appointment. So we're working with the state on that, hopefully technology improvement, so it'll be even easier for our population to just find out and get an appointment. So we're working on that as we speak.
Well, that's great. And so letting people know about that. And then the only other question is, we did get an email that came in asking about whether the Eastgate site where there was a tent erected as part of a potential isolation, if that could be used as a vaccination site as an interim.
Yeah, we're making a list. I've just, my email, it's what a blessing. My email is full of organizations offering for either pop-up sites, for drive-through sites. It's very inspiring, I have to tell you. If I had the vaccine and I knew we had enough vaccinators, we would cover the entire county right now. It's been that inspiring. So I think we're going to look at sites that King County has done, but you know, in the best of all worlds, what I know in terms of the federal government is The COVID package that was passed, it didn't have a huge amount of money for local government to do vaccination, for public health to do vaccines. So I'm actually really making a pitch to businesses and the healthcare system and the managed care organizations to partner with me. Because in the ideal world, we'd have a facility, we'd have the tactical help from our businesses, and then we'd have the healthcare system coming in to do the vaccinators so that we could get the biggest spread all around the county. So I'm just thinking as big as possible right now and trying to get everything lined up so that we can deploy when we know we have a vaccine.
Thanks.
Great. Thank you so much. Okay, Councilmember Barksdale.
All right, thank you, Mayor. And Director Hayes, thank you also from me to you and your staff for all the work that you're doing in response to the pandemic. A few questions, I'll just ask all of them, and then it's not a lot, but and then I'll just turn it over to you. Home tests, how effective are they? And how are you accounting for them in your numbers? So as I understand it, there are two types. There's the one where you take it at home and you send it into a lab for assessment, and then there are also home tests where you take it and get the results at home as well. And any thoughts sharing on that? The second question is, in terms of indoor or outdoor dining, I'm seeing different levels of sort of outdoor, what I might consider pseudo outdoor. Is there any meaningful difference between sort of the open versus the enclosed tent canopies, if you will, for outdoor dining? And the last question is and I'm a little fuzzy on this one, it's really just exploring here. Are we expecting to see any sort of relationship between the vaccines and the numbers of COVID cases? If so, what can we expect in terms of that relationship?
Okay, got it. Thank you. So let me start with the last one first. So if we're successful with getting folks in 1A vaccinated, what I would expect to see, because again, we're concentrating as part of that in long-term care, I would expect to see the number of cases in the hospital start to go down because we know that they're the most vulnerable. We would see our death rate go down. And then at one point about a month and a half ago, I think we had 100 of our EMS personnel quarantined because they were exposed to one way or another. So that will go down, which will be really good in terms of the expectation our community has for response. So that's an immediate, I hope that gets to your question. That's kind of the association. Did I hit that right, Council Member? Great. Outdoor dining, the whole ventilation thing, my team with environmental health that works with restaurants, they've been trying to answer as many questions as possible as the science evolves. So it's all about whether or not there actually is airflow through it. So you can have something that has sides and, protects people, but has good airflow. That's the key. And of course, the distancing. The restaurants have been doing, on the whole, a really good job of spacing and trying to get through this. It's just that industry has been so hit hard with this. It's just awful. I look at my favorite restaurants just nearby where I live, and I pick up as much as possible to support them. So that's really the thing about outdoor dining. And my team, if you have any questions, is happy to talk with you. Home tests. This is going to be really interesting. And in the future, home tests are going to become more and more. Your question is right on. If they're the tests that just show you what it is, but it doesn't get into our data system, then we have no way of tracking things, of assisting people. It really is actually kind of challenging. Although we know that eventually, like other home tests, it's going that way. But the ones that you mail in, it depends upon the company as to whether or not they're plugged into the lab reporting system they're supposed to be from the state. So we're really struggling a bit with the emergence of all sorts of different kinds of testing. There's so many different kinds. We're still using the gold standard of the PCR tests. And we have one of the best systems in our drive-through testing sites, our mass testing sites, where people generally get their I don't know what experience you all have had or you've heard, but our average is that people hear back on their test within about 30 to 36 hours, which is really a gold standard around the country.
Great, thank
Okay.
you.
Thank you. Deputy Mayor, did you have a question?
I did. Thank you, Mayor. And Director Hayes, again, thank you for being here tonight. Appreciate the update on obviously this very important topic that affects so many. I want to just ask you one question, just something I read in the Seattle Times, they believe it was yesterday or the day before, about the vaccine itself. And I know you're just part of this total equation here, but I know that the vaccine has a limited lifespan, and this goes to not being able to get the vaccine out quick enough, and there's danger of some of the vaccine actually going bad, which I'm sure nobody wants to see. So I'm just curious, how long is that lifespan, and are we at risk, especially in King County, of losing any of that crucial vaccine because we're not able to get it out quick enough or set up those appointments quick enough? And then the second part of that question is, do you know if in King County that all assisted living or senior living facilities now have appointments to get their vaccine?
Okay, great questions. Thank you, Deputy Mayor. So first of all, in terms of the vaccine viability, there's two different vaccines and their storage requirements are so very different. But let me cut to the chase here. We are working really hard with the Department of Health to try and get a better visibility. I believe that the holdup for some of these vaccines is really this relationship that you're asking about between the nursing homes and the assisted living and the pharmacy. Because what we want is, if the pharmacies are not able to deploy, we actually want to transfer those doses to the hospitals who can get them out. So we're in active conversation with the state on how do we, the state doesn't even get that visibility. So they're talking with Operation Warp Speed about breaking that down so that we don't have to worry about that. So that's really key to this. One of the things that my team's developing is a dashboard that we will, when it's ready, we will turn it public so that you all can watch it too, so that we can track where the vaccine's getting out and how many doses. We want to get that down to more the community level so we can see if we have areas where there are vaccine deserts or something we need to address, because we would then put strategies in those places. So we have that developing. And then lastly, we really, in terms of the vaccine, and there's actually potentially over the next few months, different vaccines that may come on the market as well. Dr. Duchin is aware of at least 3 other manufacturers that he doesn't know how many of them are ready to go in phase 3. But in the ideal, we will have even more vaccines and even easier ways to store it. So your question about, are all the nursing homes signed up in this partnership? So the nursing homes themselves in King County are pretty much 94, 96% of them are in the pharmacy partnership. A great majority of the assisted living are as well. The sector that's not is the adult family homes. There was a very low rate of those. And of course, those are small. They're owned by families, or if they are, have multiple ones, it's still it's a relatively small business. And it's harder for those people to plug in. So we are doing a massive effort for all 1,400 of them in King County of contacting each one and finding out, so we can either get them plugged into a team to come out to the home or find out what their situation is. So we will get through there. It's just going to take us a few weeks to plug the holes here for those very vulnerable folks.
Thank you for that answer.
Okay, Councilmember Robertson.
Great presentation. Thank you for being here and answering all these questions. Yeah, I wanted to echo your comments about the state website. I went on to that to see the different phases of who gets to get vaccinated when, and they have an alert system where you can put the information in and sign up for an alert when it's your turn. So I signed my parents up. My dad's in his 90s, so that they will get a text and an email when it's their turn. So I think that that's a really great tool, and I think it's one that we should definitely let people know about. Will there be any cost for people to get the vaccine?
So the vaccine is free, and part of the federal declaration made it so providers were not to charge individuals an administrative fee either. Great. So it should be completely, in all of our sites, it's completely free. I know that providers are also required to bill for Medicare bill, but they're not billing the patient. They can bill the insurance company to help cover some of their staffing costs. So that should be it. But for somebody that doesn't have insurance or is underinsured, there's no cost to them.
That's really good to hear, because I think that some people might be worried about that. And I know the rollout can be very difficult because people need 2 doses. One of my children is a healthcare worker, and she got her first dose this last week, but you have to hold some back so that she can get her next dose in 24 days. So I imagine that logistically it's rather challenging. I had a question generally about the COVID response and public health working with the school districts. So we have 115 school districts in the state of Washington that have had either full or partial in-person school. About 90% of all private schools are doing some sort of either hybrid or in-person. But most of the school districts in King County are closed. And the pediatrics, I think it's a Pediatrics Association, just came out with an article today in the pediatrics publication that there's been 0 cases of children to teacher or children to adult transmission in schools. The even child to child transmission in schools is incredibly low. Most of the cases that are in schools are from community spread, as you talked about. So I didn't know what the health department in King County is doing to help the schools figure out how to open safely, because we're seeing a lot of mental health issues with children. We're seeing children just disappear completely, maybe at-risk kids. And I mean, that in and of itself is a public health crisis from my perspective. So what are you doing to work with the school districts so that they can figure out how to open safely? I guess that's my main question. And also, what are you doing to work with the governor's office and our local business community, because we're not seeing a lot of spread in the restaurants or in retail shops, yet so many remain closed, and unemployment and loss of income also can create a lot of public health challenges for people. So what are you doing on that?
So I really agree with you about the trauma to kids not being in school and families, and it's just layer of trauma because of this pandemic. I've been actually meeting dynamically with schools all across the county all fall. Dr. Duchin and I have taken the position here in King County, which is a little different than some of the other surrounding counties, that we have never made a flat statement that schools should not be open. We have always been working with the principals and the superintendents to try and talk about the youngest children, the children with special needs. How do we begin, how to assess their facilities? It makes a big difference if a school has classrooms that have better ventilation, that have larger spaces, that are able to work in smaller cohorts. And so it's so unique per almost every building almost, that it's been a real challenge. So one of the things that you brought up, which is absolutely true, is the science is emerging, showing that children get COVID, they pass it, but it's not what we usually see, which is they get sick and they make a lot of other people sick too. That's just really different than our usual experience with children. And so COVID is very different with children. And so this is emerging science. And so I think that part of it is a challenge for not necessarily the kids, but what we see in workplace outbreaks is it's staff to staff. What's happening, whether or not it's in the healthcare sector or in some sort of manufacturing that we have here, is folks let down their guard in places like break rooms and where we normally meet with each other and talk or have lunch. And that's where, in some of these cases, the risk really is. The Department of Health just changed its risk factors for schools, upping them dramatically in terms of the levels. I'm saying that backwards probably. What they did was they would allow a higher level of cases in the county before a school would have to back down into remote learning in their recommendations. So I think the schools are reassessing that. I think that there is a big discussion with the teachers and the teacher unions that have been challenging for principals, and to build the feel that everybody's working together to get what we need to do for kids. So this is going to be evolving. It's one of the things that clearly the governor is trying to put in this phase perspective so that teachers can be in a line so we can get kids back to school for sure. But, you know, I must say that the schools, if they follow the protocols, we have been supporting them doing small. I've encouraged them to go slow and to try something out and see how it works. And to see how many outbreaks. In the very beginning, you may recall we were having cases in schools and they were having to shut the whole school down. And that happened back east as well. And they don't want to open up and have to close again right away. So there's lots of factors involved with that. Your question on businesses and the governor's office and the factors, I must say that when we're interviewing people who have COVID and they try and remember what they were doing 2 weeks ago, they've done a number of different things where they could have got it. So it's really hard to nail down and say it occurred in this restaurant, it occurred in this neighbor's backyard, it occurred at the wedding, because as we interview people, they have not done just one thing during that vulnerable time. So when I'm talking to restaurants, I recognize that there's not a lot in the data that shows exactly this transmission. But my data does show the restaurant outbreaks. We do have outbreaks relating to restaurants where the staff get it. So these smaller areas where ventilation is a problem, where people are taking their mask off, where they're staying for up to an hour, and where you can't socially distance people inside in the kitchen, all of those are a recipe for transmission. So we all want these businesses back open and to get back to normal. So my role in this is I just try and provide the facts as best I know it and then keep up with the science.
Well, thank you. Thank you very much. I'm wondering if you can tell people where they can ask questions, either what website or what email to go to, and also how to sign up for the vaccination alert. And if you can't do it right now, maybe you can, after this, speak with our city clerk and provide that information.
I will do a follow-up with the clerk, because I must admit I came off busting into my house at the very last minute here to come on board, and all of those things I had hoped to get prepared, and I didn't. So my apologies on that, and we will follow up so you have all the information you need.
You did an awfully good job. Are there any other questions? I know we need to move on, but Councilmember Lee, last question.
Thank you. Quick question. Thank you for what you're doing, Dr. Hayes. My question is about vaccination. There's, two vaccination talked about, Pfizer, and also the Moderna. Is there any particular thoughts about asking for a specific one? Also, that's the first question. Second, it's a question of maybe taking half of a dose without taking the second one so that you have more to go around. What you're thinking about those?
Well, thank you for that question. So the good news is both of these vaccines are 95% effective. So there really isn't a need for you to request one over the other. The Pfizer vaccine, there's 21 days you have to space between your second one. The Moderna one is 28. I don't know why there's a difference, but in the clinical trials, that's the way it worked out. There are certain populations where for them, in our partners to get the vaccine out, like in mobile units, we're going to be using more of the Moderna vaccine because it travels better. So really your healthcare provider, wherever you get it, will have the best vaccine for that vaccine site. But for all of us, whatever one we can get, it is the best. And I just forgot your second question. I apologize.
My second one was, there's a conversation that just take half of it. And
right. Thank you.
To have more people covered than, it's adequate for the first.
Right. Thank you. Thanks for that reminder. So that was a discussion that's going on in Europe. So we're going to learn what Europe's doing. Right now, Dr. Duchin feels very firm that we should follow what came out of the clinical trials, which is these 2 doses. Now, as more vaccines come on the market and more science is known and watched, we'll evolve with it. But for right now, we want, and that's what even up to Operation Warp Speed, they believe we will be able to get enough vaccines so that everybody can have that 95% effectiveness.
Okay, thank you so much. Really appreciate you taking the time to join us, and great information. And thank you also for the reminder to shop local, eat local, take out food, support our local business any way that we can to get through this. So thank you again, Patty. We'll see you at our next monthly meeting.
Thank you all. Take care. Take care of yourself. Remember, masks, distance. Take care. Bye-bye.
Bye-bye. Okay, Mr. Miyake, what is our next item on your list?
The next item, Mayor and Council members, is with regard to the Conflict Resolution Center. This is an update. And just by way of background, Bellevue's Conflict Resolution Center provides conflict resolution services that address community disputes between neighbors, businesses, as well as other public entities. It's been a while since we last provided an update to the council, and in 2020, the center experienced an increase in cases and is anticipating even a larger increase due to rent arrearages and potential foreclosures, all due to COVID. So joining us this evening is Mike McCormick-Huntleman, Assistant Director, as well as Marcy McReynolds, Conflict Resolution Center Manager, to provide the council with an update this evening. It is informational. This is informational for the council, and no direction is being requested at this time. So, Mike.
Thank you, Mr. Miyake. Robinson, Deputy Mayor Newenhouse, council members, it really is a privilege to be with you tonight. I'm going to share my screen so you see the presentation. Tonight, we are going to focus on a pretty brief update on the Conflict Resolution Center, and we're really going to focus in on the impacts that we're seeing through the center regarding COVID-19. So what we experienced in this last year and ways in which we've had to pivot the program to better serve our residents. And as City Manager Miyake stated, this really has to do with an increase in renter-landlord tenant disputes. So how we've come around that and how we're supporting the community through increased needs in that area. As we mentioned, tonight's presentation is for information only, so we're not asking for any council direction at this time. But to lead us through this presentation, I do want to introduce to you Marcy McReynolds. She is our manager of the Conflict Resolution Center. So Marcy, please take it away. I believe you're muted.
I've just got it. Thank you. Hello, council members. It's good to see you again. It's been a long time, and I'm glad that you're healthy. So I'm just going to share with you what we're going to talk about in the next few minutes. First of all, just kind of give you a snapshot of the program over the years, and then show you how it's changed in the past year. And then we're going to be looking at what has evolved because of the pandemic, and then looking at we're looking at the next year, and then giving a little shout out about our volunteer training at the end. Next slide, Mike. Thank you. So our mission always has been, the BCRC, is to build the problem-solving capacity among the people who live and work in Bellevue. And so just to give you an idea of some of the sorts of cases, we usually on an average, the center does about 300 cases a year, lasting from 10 minutes to 6 months. We deal with trees, fences, boundaries, noise, landlord-tenant issues, parent-teen, foreclosures, trying to keep people out of foreclosure actually. And most of our cases are referred by either residents or different departments, code compliance, police, utilities, transportation, other departments refer cases to us. We also teach classes in the community. Our probably most well received is the listening classes in partnership with the library. They're usually full and highly diverse. And our program is relies heavily upon wonderful volunteers who go through a mediation certification process in our program. We do have a training coming up, which I'll talk about later. And they used to come in, and back in 2020, the beginning of 2020, our volunteers came in 3 hours a week, sat down at the desk, answered the phones, and we all talked and we mentored and discussed cases, and that changed. And just to let you know, we're also a member of Resolutions Washington, which is a statewide consortium of dispute resolution centers. And this means something in a minute, you'll hear. And we have, as I said, we're 1.8 staff. We now have a CARES Act staff, which I'll mention. And then, next slide, Mike. Then, as we all know, and as we just heard, COVID-19 reared its head and changed everything. And the thing that we had to adjust quickly. We had everyone working in the office, and then we transitioned to people working at home, including volunteers. And we set up a mentoring program. So we had experienced volunteers working with less experienced volunteers because staff couldn't be right there in the room with them, with everybody. We put the listening classes into Zoom, mediations went online, and then we started noticing that our cases started changing tenor. And at first it was cases, people were worried about their safety within their apartment. If they were looking for a new place to live, they were scared about distancing, like the right-of-ways. We started having issues in right-of-ways in neighborhoods because people were walking and didn't feel safe enough passing through a narrow gate or an opening. We also had people with issues with businesses. And we started seeing an uptick in landlord-tenant issues, people getting behind in rent, and even some businesses behind in rent. And so we, toward the end of the year, our cases, our landlord-tenant cases, which averaged a year, maybe 30 cases, suddenly just mostly in the last quarter went up to 112 cases landlord-tenant. And over our overall in 2020, we went from 300 cases average to 356 cases, and they're increasing. And so because of the increase in landlord-tenant cases, everybody was noticing this statewide. And next slide, Mike. Thank you. So in August, the governor put out a proclamation that mentioned us dispute resolution centers and encouraged landlords and tenants to avail themselves of our services to help them negotiate rent repayment plans. And then the state AG's office put together a rent repayment worksheet, which then we worked with the AG's office to put together a training. And here was something that was wonderful that happened. And that is that we were already on the phones. We were already, instead of in person, doing mediations, as most of the centers around the state were. So we were able to pivot fairly quickly. And so we put together two long trainings with statewide for all the dispute resolution centers and all our own volunteers, working with the AG's office to train everyone in how to do what we call phone conciliation to resolve landlord-tenant cases, to put together repayment plans. And so next slide, Mike. So a little bit about our rent negotiation program, which we have been spearheading. We started out by working, piloting with a property management company. We said, can we use your tenants as our first clients to practice on? And so we started working with them. They had a number of buildings in Crossroads. And we started working with them, and so we could get it down. We have an agreement to mediate. We help them put together a plan that's feasible, something that the tenant can do given wherever they are with whatever income they have or no income. And we put together documents to help the tenant prove that their hardship was related to COVID. And then we also work with the landlord to see what the landlord would be willing to negotiate. We also have reached out and have many, many partnerships with the assistance agencies and with human services at the city. And I did a workshop with the Eastside Homelessness Advisory Council, I believe it is, as well as worked with the school district, the wraparound program, and other agencies. And so we're working together. We're seeing aid, rental assistance, and rent repayment as a partnership, that those two things need to be happening. And because we're giving landlords and tenants tools going forward so that they feel safer, to protect housing stability, and also to keep landlords from going under. Next slide, Mike. So so we're going to be moving into this next year doing the rent negotiation program, and we see because at this moment the eviction moratorium is up the end of March. We're seeing that March and April are going to be really, really busy months with the number of people who are in arrears in their rents. We do what I call alternatives to foreclosure mediation, because I really prefer people didn't get foreclosed upon. And we see an uptick. We work through the Department of Commerce, who refers cases to us. And we will probably see an uptick late spring in foreclosures. We're also working with development services, working toward putting together or helping facilitate a good neighbor agreement between the proposed men's shelter, and then we're also hoping that come summer, that we'll be able to return to more online community classes, because one of the things about the listening classes is people get to feel heard, and they get to build community, and they get to connect with people again. And so they're hungry for it. And so we would really like to do that again, because it builds resiliency. Next slide. And so we have a little shameless advertisement here. We are next month having our yearly conciliation training. These are volunteers working at home. And on February 8th and through the 10th, we're having our conciliation training. And we have a few slots left. So putting the word out, anybody who feels that you are a good listener, that you like to help people come together, you're a bridge builder, drop us a line at bcrc@bellevuewad.gov and let us know that, and we'll talk to you about coming into the training. So, and that was a lot quickly, but now open to questions, comments.
Oh, that was excellent. Thank you so much. I don't want to take too much time to do questions on each of these items just because we've got a number of other things. So I encourage council members to submit them over email. But if there's, do we have a council liaison to this program, Mr. City Manager?
I do not believe we do, Mayor.
Okay,
I'm looking to Mike McCormick-Huntleman as well.
We do not have a designated council liaison for the program.
Okay, just checking. All right, well, let's make sure that we submit any questions to you. Thank you so much, and I hope you get some good applicants for those open spaces.
Thank you. Thank you.
Okay.
Thank you.
Thank you.
Mayor, are you ready to move on to the next item?
Yes.
Okay, thank you. This is the third out of 4 items, and it is a 2020 development update and an update on mybuildingpermit.com. This is a really a good news story, and staff from the development services as well as information technology, both departments are here this evening to describe really how regional collaboration as well as strategic investments in technology has really positioned Bellevue well to quickly address the challenges of the COVID-19 pandemic. And through these investments have enabled us to successfully deliver permit services during a peak development period. So joining us this evening for a quick update is Mike Brennan, the Director of Development Services Department, and Shava Snyder, the Chief Communications Officer for Information Technology. So with that, I'll go ahead and turn it over to you for a quick presentation to the council.
Thank you, Mr. Miyake. Good evening, Mayor Robinson, Deputy Mayor Newhouse, and City Council members. As Mr. Miyake mentioned, we are here to give you just a very quick update on development activity that occurred in 2020, which was a year that nobody anticipated, with lots of uncertainty, rapid change, and really continued interest in investing in Bellevue and proceeding forward with development. So tonight we want to click to the next slide, please. Thank you. Again, this is just for information only this evening, Council. Next slide, please. So this evening, Saber and I want to talk a bit about technology investments and improvements that have been made over the last several years that really positioned us well to deal with the challenges in 2020. I want to, at this place, thank the Council for your continued support in making those investments, and they really did pay dividends over the past year and will continue to do so into the future. Also speak a bit about our partnership with the eGov Alliance and mybuildingpermit.com again, and that is certainly added value over the year, and we'll continue to do that into the future. I'll provide a brief update on development activity over the past year and share a bit about public information and how we continue to work hard to push information out to the public so that they can track what's going on with development activity in the city. Next slide, please. So at this point, I'll hand it to Saber, who will speak a bit about the technology investments and our partnership with eGov Alliance. Saber.
Thank you, Mike. Good evening, Mayor and Council members. Within the City of Bellevue, the collaborative One City focus really helped IT partner with development services to deliver over the past many years effective and efficient technology solutions that supported DS when they had to pivot to working remotely during 2020. And similar to the presentation before us, you'll hear a bit tonight about how many of these investments that we made in technology helped during this trying and historic development year. The vision for paperless permitting was achieved by development services in 2019, sort of just in time to prep us for 2020. And ITD and DS partnered to continue to innovate on development services technology solutions throughout the course of 2020. Council has heard from me a couple times now about the award-winning robotic process automation project that allowed DS to migrate in progress permit plans in Bluebeam to the cloud, while taking minimal time away from development services staff in order to do that work. And that allowed them to support the historic amount of development that happened in 2020. Another innovation that DS has been partnering with IT on for a number of years, the continued use of a survey tool called Qualtrics. And Mike will show you later in this presentation some of the data that comes from Qualtrics that allows development services to get additional customer feedback and engagement so that they can respond in real time to how customers are reacting to their work. Additionally, IT and DS partnered on some mapping solutions that showcase where development is happening and make it easier in a geographic-based view for residents to see more about projects and learn more. And Mike will also address more about those maps a bit later in the presentation. Council probably remembers an application called My Building Permit that is the premier application of a regional government nonprofit called the eCity Gov Alliance. As a reminder to Council, Bellevue is a founding partner as well as the technology service provider to the eCity Gov Alliance. And as of the end of 2020, 17 jurisdictions now use My Building Permits, which we are pretty excited about. And My Building Permit provides a one-stop portal for development service applications, things like inspection scheduling, permit status information, and tip sheets. It also allows an avenue for collaboration across the region from building officials and building inspectors in order to accomplish things in similar ways. So we made some technology enhancements to MVP in partnership with the Alliance over the course of 2020. One of the big ones was adding an e-check and direct payment option to the application, which previously wasn't available. This allowed for approximately $900,000 in permit fees were submitted using this payment option in 2020, an option that became available about a quarter of the way into the year. And this allows both sides to save money on credit card fees, which is why this was a priority for the eCity Gov Alliance. Another technology advancement that launched in 2020 was the jurisdiction dashboard updated and enhanced. And these enhancements were made specifically for permit staff to improve their workflow, including invoicing, reviewing, and closing permits. It also helped to reduce repetitive support tickets and allow folks to do more self-service that in the past may have required calling into support to resolve or complete. So basically, some of these updates allowed development services staff in Bellevue and in other jurisdictions to more effectively accomplish their work. And just by way of a reminder, I looked this up, and MVP has been serving the region for more than 20 years now, which is a pretty exciting collaboration across the region. And they continue to onboard new jurisdictions every year. So I'm going to turn it back over to Mike to talk about how these technology partnerships supported a record level of development in 2020.
Thanks, Sabra. Next slide, please. So as Sabra mentioned, we did see a continuation in 2020 in spite of dealing with the impacts from the COVID-19 pandemic of continuing kind of this trend of a peak development cycle in the city that has had a long duration, let's say, for at least the last 5 years. Next slide, please. So as you might expect, because we did have a period in the spring, the March and November period, a pause as the governor's stay-at-home order took place, and we had to put in place safety protocols for us and for the construction industry. There was a downturn in the number of permits issued, represented by this graph, which shows from 2009 to 2020, the pink line being the applications submitted and the blue line are the permits that were issued. So that was a slight downtick. The current pace of application is back up to pre kind of COVID levels. So the lines have tipped back up. But in applications, in real numbers at the bottom of the slide, we issued 14,212 permits. That represented 759 new multifamily units, 171 single family units, and about almost 2 million square feet of office development, which obviously is a fairly robust amount of office space. Next slide, please. But the real headline is really shown in this graph. This is a graph that shows the value of the permit, the value of construction represented by the permits that we issued, dating back to 2013 on the left side. And then 2020 is the graph, the bar graph on the right. Wow. The red and white stripe line is the major projects, and then the other projects, commercial alterations in TIs, and the blue residential alterations in the red, and then new single family homes in the crosshatched purple. But again, the top of the bar has now almost reached $1.2 billion, which in 2020 was the highest valuation issued in represented in issued permits in a year in the city. So that was quite remarkable when you think about all that we were dealing with last year, and we're still able to advance that level of investment through the system, and a number of those projects are either under construction or heading toward construction. Next slide, please. So it also, the inspection activity continued to be very high as well. This is about 79,000 plus inspections that were conducted in 2020. It's around 10%, a little over 10% below the previous year. But again, keeping in mind the pause that occurred in the spring, and then inspectors working under different sorts of kind of challenges, let's say, in delivering the services every day as they're addressing the safety protocols and ensuring for their safety and the safety on these construction sites. So I really need to hand it to our inspection teams who all the way through the pandemic have shown up for work, have taken the necessary steps to put in place the PPEs that they need, and to go out to the job sites to keep these projects moving. Just really a remarkable effort on their part. Next slide, please. So this is one that was, to be honest with you, a little surprising, given that we had to move all of our office staff out of City Hall when City Hall was closed, and had to quickly pivot to delivering services online. So this is feedback that we've received from our customers through the Qualtrics tool that we implemented a couple of years ago that allows us to quickly survey on an ongoing basis our customers. So the blue lines are the feedback that we received pre-COVID, and the orange line are the survey responses that we have received back post-COVID. So at the bottom of the graphs, the far left two bar graphs, overall satisfaction with development services, it is higher post-COVID at 84% than it was pre-COVID. The timeliness of responses at 87%, 10% higher than pre-COVID during our response during the 2020 timeframe. And then finally, at 93%, the 2020 level of our customers who feel like they were treated professionally and with courtesy from our staff. Again, really great information, great news about how we were really able to successfully transition and continue to deliver the services that people needed from us in a timely way, in a way that was done with courtesy and really generated overall satisfaction. Next slide, please. So the other important factor here, particularly now, is to provide information to the public about what's going on in the city. It has been a very active development cycle, and people are not only curious, but they need to know so that they can plan their day, or they're curious because there's something that's happening close to their home where otherwise they were at work during the day and they didn't hear the construction activity, and they want to know how to find out what it is that's happening or to get involved. And so we have put in place over the last several years tools that help people go online to get information about what is happening with development activity in the city, and specifically geographically, where is it located if it should be close to where they live or work. Next slide, please. So this is the Building Bellevue map. This is the map that was the mapping application that we created and implemented in 2019 that essentially shows the two core growth areas of the city, downtown and the Bell Red, where the majority of our major projects are occurring. And each of those blue dots represents a permit application or a project. And you can open the map and click on any of those dots, and an information page will come up that gives you information about that specific project. Most of them have a rendering, but they'll provide information on where they are in the permitting process and some of the facts about the nature of the project and the size of the project. Next slide, please. Additionally, the Transportation Department has created a tool that does a similar thing. It really shows the city's transportation projects. You can go to the map, click on one of those projects or one of the lines, and it will produce information about the specific project that they may be interested in. Again, they can do research in the moment. It is a very interactive tool, similar to the Building Bellevue map. So we've done a lot of work to try to push information out. These are a couple of the online tools. There are several others. And we're also working with particularly the major project contractors to make sure that they're taking that extra effort to push information out to the property owners and residents that are near their projects. Because now that people are at home, working and living, there's a higher sensitivity, and I'm sure the council has probably seen some of the email submitted to us and to the council, people raising concerns about noise or inconveniences that have been caused by these projects under construction in the city, and trying to make sure that we are being proactive and getting that information in their hands so they're not surprised by it. And also making sure that we are working hard with those contractors to mitigate the impacts that they may have, even though they're working during the normal construction hours, and particularly so when we provide an exception that allows them to work outside of the normally allowed construction and noise hours for special elements of the project that require that. So we just wanted to share a little bit of information with the council tonight. I think some of the last slide, Sabra, really the key messages are 2020 was very much a challenging year. There were a lot of unexpected things that we needed to deal with, but I think we did well and had the tools in place, those technology investments that Sabra spoke about, that really helped us successfully navigate our way through that. Our regional partnerships and technologies have been really a mainstay for us and really put us kind of at the forefront, really, in best practices in the way we deliver development services in Bellevue. Interest in investing in Bellevue continues to be very strong. It was in 2020, and we are anticipating that to continue into 2021. And I would like to just also say that it was impressive. The staff resilience and commitment as we worked through all of this was really remarkable. I am very proud of what we did accomplish, considering all of the obstacles that we had to overcome, and the feedback that we're getting from our customers is telling us that for the most part, we did a very good job. There's always room for improvement, but I will say 2020 with its challenges was a successful year for us. So with that, we are certainly available for questions, but I understand the limits on time tonight. Thank you.
Well, you single-handedly kept our economy going through a very difficult time. So thank you so much for all you and your staff did to do that. It's just amazing. Looking forward to the next phase of this. Yes. Are any burning questions, or can we move on to the next presentation? I think we're okay. All right. Thank you. Mr. Miyake, would you like to introduce the next one?
Sure. And again, I just want to reiterate kind of what the council just mentioned. Thank you very much, Mike and Sabra, for tonight's presentation and for all the great work the staff is doing. So the next presentation is actually not a presentation. It is an item on your under the manager's report, and I am seeking your concurrence. And before you tonight is the reappointment of the members of the Bellevue Convention Center Authority Board for the terms listed in the memo that are included in your packet. Again, I'm asking for your concurrence on the reappointments. Provisions of the Convention Center Board appointments are established in the charter, which states the board shall be composed of 7 members appointed by the Bellevue City Manager with the concurrence of the City Council. So tonight I am seeking that concurrence. The reappointment recommendations tonight include no new appointments. This past year has been very challenging for the Convention Center. The existing board has done a strong and stellar job in partnering with the city and ensuring the continued viability of the Convention Center throughout the impacts of COVID. So I believe that the existing board will continue to provide that stability throughout the pandemic. And so this is now in front of you for a motion to concur with my recommendations. I'll turn it back over to you, Mayor, for that.
Okay, Deputy Mayor, would you like to make a motion?
Yeah, I move that we concur with the reappointments to the Bellevue Convention Center Authority.
Second.
All those in favor say aye.
Aye.
Aye. Any opposed? Okay, motion passes.
Thank you very much, Mayor.
Okay, so thank you, City Manager, for all that. And we're moving on to council business. And I'd really like to give everybody, I didn't realize how much information and how many questions we'd be having for tonight, but I feel like we have time to do this. I just wanted to give everybody an opportunity to kind of share their experience after our diversity, equity, and inclusion summit for 2021 that occurred on Friday, last Friday. The summit provided a progress update of the city's Diversity Advantage Initiative, which was passed by our council in 2014. And it also featured a video produced by the city of Bellevue that tells of the city's long commitment to diversity, equity, and inclusion. And then the second half of the summit offered 5 concurrent sessions on various topics around racial equity, inclusive outreach and engagement, community building, and trauma-informed care. We had over 270 participants, many from out of the city and some from even out of state. So it was just an amazing success. I feel like it wasn't enough, that we need to do this again. So I hope this is the first of many of these programs, but I did want to go ahead and give everybody, because we all attended in one way or another, wanted to give each member of the council, if they'd like, an opportunity to comment on their experience. So you could raise your hand if you'd like to speak, I guess. Councilmember Barksdale, followed by Councilmember Stokes, Councilmember Zahn, Councilmember Robertson. Okay, go ahead, Council, and then Deputy Mayor. Councilmember Barksdale, and then Councilmember Lee. Councilmember Barksdale.
All right, thank you, Mayor. I just want to say thank you to the staff for coordinating the Equity Summit and all the energy that went into putting that together. It was well attended, as you mentioned, which I was really glad to see. And for the session that I attended, I think most of us as council members from that was the one on the North Star, and I appreciated our speakers and how they spoke directly about racism, systemic racism, and institutional racism, and ways to really approach it. I look forward to more of those conversations. I would love for us to take on some of that, maybe as part of as the Communities of Color Initiative takes off. I would say I am interested in the DEI dashboard that came up and related metrics. So I don't know if there's a way to get access to those. I hear the dashboard is in progress. Maybe we can get access to the metrics.
Is there anyone who can answer that? Okay, well, maybe we'll get back to you, Councilmember.
Yeah, we'll get back to you on that.
Barksdale. Thank you.
I believe Councilmember Zahn and then Councilmember Stokes.
That's fine.
I believe you had Councilmember Stokes next.
Go ahead. You're talking.
Oh, so
sorry.
Okay.
Well, go ahead, Councilmember
Stokes. Stokes, why don't you go ahead?
All right. No, I really appreciate the whole effort and the things the staff did. I've looked at everything, and unfortunately, I had a situation came up I had to handle the family, and so I missed it, and I really was kind of bummed about that. But I hear the reports back are very, very good, and I looked at all the material, and I really think it was, and I agree with the comments about having this not just one, this is not a one-off. Let's continue working on this, because I think we're at a stage where we have great programs and policies and plans in place. It was good reporting, good conversations, but not a but in the sense of something else. But I think it really in line with what we've been talking about in terms of the impact of the COVID, the impact of changes is also being felt in this area. So I think that we've laid the groundwork very well for some continued conversations, maybe some harder conversations, maybe some really exploration of where we're going. And I think people have kind of loosened up and are ready to have those conversations. So I applaud you, Mayor, for pushing this, and the staff for setting this up and doing the work on it. And I'm, and as Councilmember Barksdale said, in conjunction with our new project going forward, I think it gives us a great platform and a great opportunity to really make progress in this area and actually put things in place that we talk about. So I'm looking forward to the future. Thank you.
Great. Councilmember Zahn.
Yes, thank you, Mayor, for giving us this opportunity to comment. You know, incidentally, I was reminded by my brother that we immigrated to the United States today, 40 some years ago.
Yeah.
So it's meaningful to think about the Equity Summit then in light of that day for me. And I was really thinking about the fact that, you know, we've been on a journey. We have a very good foundation for doing this work. And yet there's more work to be done. And some things that were some takeaways for me. And actually, first of all, I really want to thank the staff for putting this together, because it was a lot of work to organize, getting the speakers during this virtual and making the breakout sessions meaningful when you're all remote. So that's a really important thing. Some takeaways that I hope that my colleagues would consider is that one of the things that Dante and Christina talked about in the North Star section was that the organization moves in the direction of the kind of questions that we ask. So where we spend our time, what we focus on is really important. The other thing that was brought up is that we have to be willing to be committed, because this work is hard and we're going to see pushback as we work on equity. And then focusing on the outcomes and not just the intention, because the intentions are not enough if the outcomes that we're seeing don't result in that. And then lastly, they talked about the 4 questions that we might want to consider as part of the equity lens. And we've certainly talked about using an equity lens in our policy making. So I'd like for us to consider, perhaps in the upcoming retreat, you know, being able to incorporate the questions around underlying assumptions, how the policies might be a burden on communities of color, how we involve the most impacted in decision making, and what strategies we might employ to remove the negative impacts. So, you know, what I really liked about the North Star discussion was there was very good how-tos that we can actually implement to start this journey and moving us more advanced in this direction. So excited to work with my colleagues in the future in this work. And thank you.
Councilmember Zahn, may I ask, how old were you when you came to this country?
I was 10.
Wow. I'm sure you have a powerful story. All right, let's see. We go to Councilmember Robertson, I believe.
You and I'll keep it brief. No, this was a good experience, and I'm really pleased at the work that staff and leadership did in putting it together. The response and the number of people, we had almost 500 people come to this remote session, which 3-hour remote session, from out of the county to out of state to people, a lot of our staff and leaders of the city also were participating, which I thought was really a great response. There was a good discussion. It was the leaders, I was in the North Star session as well, were really, you know, spoke so well and were very clear and helpful. And people on the chat kept saying, I want copies of these PowerPoints, you know, because it was so good, the information they provided. You know, I'm really uplifted in the commitment I saw from the people of this city and the people I saw elsewhere outside of Bellevue at being so invested in creating a more equitable and inclusive environment. And I think that this is one of the steps that we can take. It's just the first step, but it's one of the steps we can take to make sure that when we have immigrants coming over here, or when we have people who may not always be treated as equally as others, that we can help find a way to make things more equitable and inclusive for everyone. And so I'm really proud of this organization and this council for going down this pathway. I also wanted to reflect on something that I think Christina said, where she said that the budget is a moral document of the city. And, you know, it was interesting because we hadn't had this session when we passed our last budget, but we all were talking about how the budget is our biggest policy document and it shows our values. And that was something that I know is important to all of you, and it's important to me. So I think that we're walking some of the talk, but there's a lot more steps to take. So thanks.
Thank you. Deputy Mayor, I know you were doing a ribbon cutting for a women's homeless shelter when this session started, but you were able to make it when you got back. So what were your impressions?
Indeed, Mayor, thank you so much for that. Yeah, would have liked to have listened to the entire summit, but echo my colleague. It was just tremendous work by staff to put this on. I was able to listen to the majority of the North Star presentation by Christina Samir James and Dante James, which was outstanding. And like Councilmember Robertson, it was so great to see so many members of our community engaged in that conversation and wanting to be a part of that conversation going forward. It was really great to see so many people committed to that. So I look forward to, and I believe the majority of the presentations will be available for on demand, not only for our council members, but for the general public as well. So it would be great if we can help promote that. And Brad, I'm not sure if you can speak to that, if it will be promoted and where it will be placed on the city website, but it'd be great to certainly highlight that and point people in that direction, as well as give them an avenue to sign up for the next one when there is that next summit or next talk that we might have.
We'll certainly make that information available. It was recorded, so it will be available. And to your point, make sure that we highlight additional sessions that we have like this.
Great, thanks, Brad. And again, great job by staff. Incredible work, thank you.
Thank you. Councilmember Lee.
Thank you, Madam Mayor. I'm pleased to see this wonderful effort in this diversity inclusion conference. As Councilmember Robertson said, the budget reflects our values. So I'm really glad to see our budget this year. As I said before, the initiative the City Council took on reflected the transformation budget to really show how we are placing our value on human value, to reflect on the most challenging, difficult value that we have. This is my personal journey since coming to the United States in 1958. That's a long time ago. And, the reason why most people come here, still continue to do so is because the value we hold, freedom, liberty, and justice for all. And this is a long journey, and we're continuing this journey. And, we've made a lot of progress, obviously, but it's not enough. It's a long way to go. And so I think we've taken a real good step. Bellevue, I'm proud that has done very well in the past. It is still within the realm of, we still have got a lot more to do. But we need to start moving forward based on what we've done, that we should be proud of we've done, and learn from what we've done and what we have not done. The most important thing in getting something done is to learn and take action. Just by talking about it, we've been talking about it for, as many years as we are moving forward. But we say, gee, why haven't we done any more? Okay, so let's be real. And let's take a look at Bellevue. I don't want to go through a lot of detail, but since we have a little bit of time, just to give us a context. Bellevue says, welcome the world. We have indeed welcomed the world. When I came here to Bellevue in 1967, our minority population is less than 10%. And people consider Bellevue as a little white city. And we also claim that our diversity is our strength. It is, in fact, we've lived that. And so the Bellevue has grown. Now, today, we're not 10% minority. We are a major minority city. We have more than 50% as the minority. 40% were born outside this country. People who came here to look for freedom, liberty, and justice. And it's not easy. And we said that we embrace the future. We do. In looking at an example that many of us, we live here, we remain here, we grow our family here. Additional immigrants continue to come here because we embrace the future while respecting our past. It's important. It's important we respect everybody, respect what we have accomplished. But at the same time, we need to look forward to the future. So it's a long road, long journey. So I think we need to make sure that we take stock and then make big, bold actions. The council has to lead, but we need to make sure we take those actions. And as somebody mentioned, Dante and Christine, I think they're a very good leader, team facilitator. I really appreciated what they're saying. What we need to do is we need to learn about our history, about what our vision is. We have to teach our young people, the other people who may not remember or who may not have their priorities set straight, or may have other important issues in life. We need to make sure that we are on the same page and move forward. So I think it's important we do take the time, we do take the stock, and we educate. We need to make sure that people who, don't remember, don't pay attention, need to be educated, need to be paid on board. We need to build a relationship to say, hey, what is we are going after? What are our common goals? And let's get on the same page. Let's not leave anybody behind. We are all in this together. We are Americans, we're United States of America. We want to accomplish the value that people come here, value here, freedom, liberty, and justice for. The most important one is equality. Equality. We're all equal. We respect everybody. Let's do it together. So I really appreciate this first step moving forward. I hope we can continue to build that relationship to get on the same page and act. Thank you.
Thank you. How old were you, Councilmember Lee, when you came to this country?
18.
Wow. Great. Thank you. Well, thank you both for your service and everybody's service on this council. I just really appreciate it. I learned a lot. Every time I do one of these summits or seminars, I learned something new. And I think the thing that I took away from Friday was that, we all have affinities for things, and it kind of dictates the path that we take. And it's really important to go outside our comfort zone and try new things and meet new people. And so this process of opening our thoughts and our minds is not always a comfortable thing, because you do go outside your comfort zone and what you have an affinity toward, but it's really important, and we'll be doing it together. So look forward to the process. Thank you, everybody. Okay. Pardon?
I was just gonna put a plug in for MLK Jr. Day event, Martin Luther King Jr. Day event on Monday.
Okay.
Next Monday. So.
Yes, great. Everybody be there. They always do a very good job there. Do you know who's going to be speaking?
I don't know it off the top of my head. Okay.
Yeah. Well, it's always good. All right, next we're on to the consent calendar. Do you have a motion to approve that?
I do. I move to approve the consent calendar.
Second.
All those in favor say aye.
Aye.
Aye. Any opposed? Okay, that passes. Now we have a public hearing. Mr. Miyake, would you like to introduce that for us?
Yes, Mayor. as you mentioned, we have a public hearing and action on some sewer easement releases. They're located at 10235 Southeast 6th Street. Joining us this evening are staff, which are headed up by I'm going to turn over to Ira McDaniel, Real Property Manager, for a brief staff report, after which we'll be seeking some direction from the staff. Ira?
I think you're muted, Ira.
Ira, can you hear us? Oh.
You may not be plugged in all the way with your headset.
Perhaps I could go ahead and if Ira's not available.
Can you hear me now?
Oh,
yes.
There you go. Okay.
Okay, sorry about that. I had the wrong one selected. It was working before and it didn't switch back. I'll get the screen share up. All right, can you see the screen and hear me?
Yes.
Very good. All right, thank you for your patience, and Mr. Miyake, and good evening, Mayor and Council members. Our staff report tonight is on a request to release a sewer easement and a portion of a second sewer easement, both located at 10235 Southeast 6th Street. Tonight's public hearing, as always, is to allow the public an opportunity to comment on the release. The easements are located on the property that's shown here in purple, and this is near the intersection of Southeast 6th and Bellevue Way Southeast. This property is being redeveloped, and through the permitting process, it came to our attention that the current sewer easements do not align with the location of the actual sewer main. So we're looking to correct that, and our recommendation is to process a full release of the sewer easement that's shown here in orange, and a partial release of the easement shown in blue. And then the property owner will grant a new easement to cover the actual location of the sewer main, which is shown in purple, and they will complete that before the older easements are released. So following the public hearing, staff will request council action on the proposed resolution authorizing the release of the easements. And that ends the staff report. We will be available for any questions following the public hearing.
Okay, great. Is there a motion to open the public hearing?
I move to open the public hearing.
Second.
All those in favor say aye.
Aye.
Do we have any public comment or questions on this, City Clerk?
Yes, thank you, Mayor. There's one speaker signed up this evening, and that is Sally Nodell. Miss Nodell, can you hear me?
Yes, I can hear you.
Thank you. Your time begins now.
Thank you so much for this opportunity to give a little comment. My name is Sally Nodell, and I am speaking on behalf of my mother, Ellen Nodell. I'm her durable power of attorney for everything. And she owns property at 617 Bellevue Way Southeast, directly south of the subject property. And I'm also the daughter of John Nodell, who's now passed away, but I just wanted to give a little shout out to Conrad Lee. I know you worked with my father a fair bit, so good to see you still on council. So my mother's house is downhill, significant elevation drop. I'm also an architect, so I know a thing or two about what I'm talking about, from Bellevue Way. And I've gotten really great assurances from Kim Bowie. She's awesome staff person and very responsive. And she's really assured me that there's no way there will be a time period during which the existing easement is released prior to the new easement being secured in place. That would be my only concern, is that the city of Bellevue would release the existing easement somehow prior to being sure that the new easement is finalized in place, because being downhill of the main and Bellevue Way, the properties here where my mom lives that are that would be impacted by this, it would be remarkably significant. Retrenching up to Bellevue Way, installing a pump station essentially to pump the sewage uphill, which is of course never a good idea. So basically that was all I wanted to be sure, was that we had complete security that we will have, a secured sewer easement across the property for my mother's house. Thanks so much again for the opportunity to comment.
Thank you.
Thank you, Ms. Nodell. At this point, that's the end of our pre-registered list. I would like to ask if there is anyone else connected to this call who would like to make a comment during this public hearing. If so, please raise your hand using the raise hand function or *9 if you're connected with a phone. Mayor, I do not see any additional hands.
Is there a motion to close the public hearing?
So moved.
Second.
All those in favor say aye.
Aye.
Aye. Any opposed? Okay, so are there any questions or comments about this?
I have a comment, a question.
Councilmember Lee.
Thank you. I'd like to say hi to Sally. I miss your parents very much. Yeah, I'm glad that she's well. I want to ask the staff if her concern that's expressed, not implying that I'm playing favoritism or anything, which I probably will in this case. I will make exception because he's such a great resident of City of Bellevue. In fact, when he spent a lot of time working on the city community and all that stuff. So they live here for a long time. Anyway, so I want to ask staff the concern she expressed, is that taken into consideration and will that be addressed?
Thank you, Councilmember Lee. Yes, that will be taken into consideration. We will not release the old easements until the new easements are signed and in hand by the property owner. That's more or less our standard procedure for this. We will get the new easements in hand, and then we will file both the new release and the release and the new easements together at the same time, so there's no gap in time.
Good. So there will be opportunity for others to review and then can be corrected if it's something that can be or need to be addressed, right? Yeah.
Correct. Yep.
Okay. Thank you.
Any other questions or comments? Councilmember Robertson.
Thanks. No, I know that that's our standard procedure. And if you look at the resolution itself, it says that, where'd it go? It says on here that a replacement easement will be conveyed, which provides the public benefit. It might be helpful in the future, not for this one, I'm ready to pass this, but if the section that says that we're authorizing the execution of documents included in it subject to the made that a condition of or subject to the granting of a new easement as described herein. I think that would make it more clear to the public. It might make it clear to the neighboring property owners, and it certainly makes it clear to everyone who reads the resolution that you're not going to release the easement until you get the other one. So that's just a tip for future ones of these. But if no one else has any questions, I'm happy to make the motion to go ahead and adopt this. Okay, so yeah, I move to adopt Resolution 9871, authorizing the execution of documents necessary to release an existing sewer easement and a portion of a second sewer easement located at 10235 Southeast 6th Street, which have been declared surplus to the city's needs and are no longer required for providing continued public utility service, granting and recording such release being deemed in the best interest of the public.
I second, with the understanding what's being discussed earlier about the protection of what Councilmember Robertson suggested. Thank you.
All those in favor say aye.
Aye.
Aye. Any opposed? And that passes. Resolution 9871 passes. Thank you very much. So we've come to the end of our meeting. I just want to say, we're all outside of our comfort zone. We're all experiencing things we've never experienced before, and yet we're doing it together, and we're doing it as a council, we're doing it as a city, as a community, and we're succeeding. And it's just very moving to me to see those development numbers for 2020. Whoever would have expected the confidence in Bellevue that we see, except we believe in ourselves, of course, but really we're doing it. We are making it. We just need to continue to work together. I just want to thank everybody on the council, staff, and community for continuing to work together. Really appreciate it, and we'll keep on. So Councilmember Lee has one more comment, I see, which is going to open it up for everybody, but go ahead.
That's right.
I think what I hope that would be a good thing to do, since the mayor opened it up, I took advantage of it. Very, very rare opportunity. I want to compliment Mike Brannon and the development services folks. Amazing. Many of the things I can compliment on, but the most important one was the satisfaction that the people have given them during COVID before then, in a comparison of what people have felt about the service they provide. They're out there in COVID pandemic, and they're doing their job. And that's amazing. That's a second, of course, which is the technology we've developed. I mean, it's not overnight. Remember, I came to the council 27 years ago. We talk about technology investment. We spend lots of money, lots of time. It's just continuing for 20 some years, and that is paying back. And of course, technology itself doesn't do anything unless we take advantage of it, unless we use it to the right purpose for the right reasons. And it has been, it's paying fruit, the e-permit, all that, my permit process. It's just amazing. It's good for the whole region, not just Bellevue. I think that's another unique part of Bellevue. We don't just hoard it ourselves. We share with other folks. So that's why we are a regional leader from that perspective. The third, the last one is, because of Bellevue, I want to say good fortune, but because Bellevue is Bellevue, our education, our people, our quality of life and everything, business continue to come here. Look at starting even after COVID, business continue. The chart the mayor talked about, it doesn't happen by accident. It happened because we have the right people, right community, right neighborhoods, right people that elect people like us to the council, right staff. We continue this process. I hate to see that disrupted. I really want to see, because the world is breaking up, the country is, but we are the shining light on the hill. So let's keep it that way. Thank you.
Thank you. Councilmember Stokes, I saw your hand up.
Yeah, I agree with that. I think Bellevue is in a very great place, and I've said over and over that I think what's been amazing is that with this COVID and all things going on, that Bellevue continues to move forward. I do want to also say that, to me, this whole thing sets up, I think, we can't just be complacent and pat ourselves on the back that we're so great and all this stuff going on. And we've done a lot over the years to make it that so, but we have some severe, very serious issues to deal with because we're a city, we're growing, we're becoming bigger, more people in here. We have different aspects to work on. We just had this workshop to talk about equity, and there are some real challenges we have facing us. So I hope that we don't just get tied up with Bellevue is great and so everything's okay, because Bellevue is great, but it needs to be greater, and we have the capacity. And this council, I agree with this, that this council can do this, and the staff. We have the capacity in Bellevue to really do amazing things and to really deal with equity, deal with the changes, deal with how we're going forward to the future. And it's nice that we have the past, it's nice what we're doing now, but we have to meet the challenges. So let's keep that in mind, that we need to keep going onward and upward, not just keeping along a straight line. So this has been a very encouraging conversation and meeting and the things we're passing. But again, it's exciting to be at this time of the year, and the years ahead of us really are an opportunity to make Bellevue even better than it is now. Thank you.
I hope the mayor
well,
would
I'm
say
going to,
that.
Councilmember Lee, I'm going to ask Council Member Zahn to have a turn to talk. Thank you.
Yes, thank you, Mayor. I was also thinking about the presentation we heard earlier today from Marcy McReynolds, because to me, like my colleagues have already talked about, there are challenges ahead, and it's about the people. So my sense is that as we continue to grow and we address all of both the joys and the challenges of that growth, our ability to connect people and work through conflict in an amicable way is going to be even more critical and important. So my hope is that we continue to support that program. And the more that we have those ambassadors and volunteers that are trained up in that, my hope is that actually everyone in our community has an opportunity to learn those skills, because I think they're really life skills of how we work through the challenges. And I think COVID has only highlighted the stress associated with it. And the fact that they've been able to pivot virtually to try to get people together to resolve issues is just amazing. And especially grateful that they're going to be working on the foreclosure prevention mediation and rent negotiation, because I think that will go a long ways towards helping our community through those really, really tough pieces that will only help the entire community. So thank you.
Thank you. All right. Oh, Councilmember Barksdale, please.
I'll keep it short as I usually do. I just want to build on what was mentioned by Councilmember Stokes and an earlier comment that Councilmember Zahn talked about. So I just really brief. I think we are making a lot of progress and doing a lot of good things. And the big piece for me is, tying it to what we heard from Dante and Christina that Councilmember Zahn brought up, is really focusing on those outcomes. So, and I know I've harped on data in the past, but just being able to really tie what we are doing, those activities and programs, to outcomes, but also to measures so that we know like the effect on the end result, and that is the community, right? So it's great to talk about the things that we're doing. We'd love to see the data also that shows it.
Thank you. So Councilmember Robertson or Deputy Mayor Neuenhuis, you've not had a chance to speak. If you'd like to, I'm handing it to you now.
You know what? I'm fine. This wasn't really supposed to be a time for council comments, so I will refrain so we can go eat dinner. So,
okay.
Thanks, everyone. Great conversation.
I'm fine as well, but thank you, Mayor, for the opportunity.
Okay. Thank you, everybody. Great meeting. We'll see you next week. Council meeting's adjourned.